face-to-face activities may have stopped for the foreseeable future, but that doesn't mean we have to feel disconnected. As we look towards the future in a post-COVID-19 world, how can charities maintain that human connection while being more physically distant than they've ever been before? Michał Filip Kowalik, I hope I've said that right, Senior Manager at EMEA at Twilio, joins us to tell us exactly how. As you all well know by now, I'm sure you can we have a Q&A session at the end, and you can submit a question by hitting the little two overlapping text boxes and posting your thoughts in there, and we'll make sure to get around to it. So it's enough from me for now. I'll hand over to Michał, and I will see you very soon. Enjoy.
Hi, hello. Welcome to the Twilio session today, hosted by me, Michał Kowalik. Quick introduction to Twilio. We're a cloud communication company. We provide email, SMS, voice, video in over 120 countries across the world. But most importantly, Twilio is not only the commercial company. As you can see on here on my slide, we're Twilio.org. It's a nonprofit and a social impact arm of Twilio, where our goals are expressed in that one very important number. We want to help 1 billion people by 2025, and what it means to help these people in 5 years from now is to provide a communication that creates a social impact. Things like volunteer engagement, fundraising for charities, and of course, constituent engagement. We are looking into things that are tough in our lifetimes, but also we're working on things like COVID response. We are powering many contact tracing contact centers. We're helping people to get back to work. So there are many different variables and many different ways of how we can help people. So today, I would like to talk very briefly about how can we get socially closer but physically further in the current environment. My name is Michał Filip Kowalik. I sit in London currently, and that's where my office is. And as you can hear, I'm not an English native and a speaker, and I'm still puzzled who the heck invented the word social distancing. Because if I understand the term correctly, we should be actually a little bit closer during those days rather than further. And it's all about physical distancing. But let's tackle it a little later. So the quarantine and lockdown, we've been there before. Anyone can guess where this comes from? It's 1918. It's the middle of Spanish influenza. And already at the time, telecommunication companies, like in this case, Bell, they were telling people that you actually have to stay home, but you can do so much with the communication technology. 100 years later, things improve. We not only have a phone, as mentioned here, but we have all other communication platforms like email, like SMS, like video. And what I really, really like on this picture is that one sentence in the middle, that the Bell service brings cheer and encouragement to the sick and of value in countless other ways. And for what I want to show you today is what are those countless other ways that Twilio can help nonprofits to carry on with their business. What are the biggest obstacles we're seeing from the numerous nonprofits we're working with? And we're working with many of them. The big ones, the ones you hear about every day, like for example Red Cross, but also the very small ones with the staff of 10 people. And what we're hearing as one of the biggest problems is that actually there's no staff, no volunteers due to physical distancing and the lockdowns. There's no one to do the job. And even there is availability of employees or people to do the job, those volunteers cannot engage in the real world. You cannot expect them to go into some areas. That was a problem in Western Europe back 3 months ago. We had a big project in Netherlands to help volunteers to actually be on the streets, but be legally and safely on the streets. But right now, down there in Africa, for example, it's very hard to go and be face-to-face with constituents. Everything needs to be done on distance. The old engagement systems are super ineffective. They've been built 20, 30 years ago, and maybe back in the days you were okay to send an email once a year to remind your constituents, your volunteers that you're here, and it's great that they're helping you. But right now you need a proper engagement, which means the combination of the channels like SMS, like video, Facebook, WhatsApp, email, fax. Otherwise, you're going to be lost in a noise of Twitters, Instagrams, and Facebooks, if you will. Um, the other thing we've seen, which is a bit of a problem, is even if you have a new idea, we've seen many of our partners trying to get, for example, chatbots on their websites. In order to set up the chatbot in a traditional way, it takes you months because it's a proper IT project. And this is yet an inhibitor for the nonprofits to basically change the way they operate. And sometimes, and we all know those people, there's always someone in management or a founder or in a trust who is a little bit resistant. Okay, like, yeah, we've been doing this for a very long time that way, and it worked. And why would we bother? Just let's do faster and more of what we've been doing before. So these are the most horrific examples of how nonprofits are challenged these days. And what I want to show you is a couple of examples where big and small nonprofits were managed to break through. Today, I want to talk about a pretty big one, which is a nonprofit, but it's one of the largest organizations on the planet Earth. It's NHS Scotland. I want to cover the Age UK, London-based nonprofit, and also one of a very small but very innovative company out of Poland called Migam. Let's start with NHS then. And what NHS did, as you can imagine, 3 months ago when the COVID spike started, there were 7-hour-long queues on their contact center line. The people were waiting forever to get the conversation with someone to just check if am I having the coronavirus symptoms, or should I go to the hospital, or am I fine to stay home, or should I stay at home for 14 days? Those questions weren't answered because the spike, half of Scotland calling on one phone line. You can imagine what happened at the contact center. So one of our partner company called Cancer Central, we've been doing very interesting things around the cancer help with them back last year. They have helped NHS in Scotland to build a chatbot, which offloaded that contact center, and they built it almost within, it was 2 weeks, I believe. And what happened was that not everyone wants to use the same channel in when contacting the NHS. There are people who want to have a call. There are people who want to go on the website and basically talk via chatbot. There are some people who rather go for text message because it's easier for them. You don't have to install anything. Or maybe they're younger people more used to the WhatsApp and the Facebook Messenger. So within a couple of weeks, Cancer Central built a tool called Ask Ave for NHS Scotland, which basically gives a choice of how for people concerned about their well-being to go on the website or text or use the Facebook Messenger and ask questions. And what happened was that the entire solution proved to be much more effective than the previous chat functions, which weren't connected with the real line. The usage in the first 30 days was massive. 40,000 people started using it just to get information versus calling the agent, and basically all of those, giving the additional channels for engagement, for this being socially close but being physically distant, help NHS Scotland to handle the pent-up traffic of during the coronavirus. Now let's look at the Age UK. This is not really COVID related, but this is a very bigger problem in many mature economies like UK, Scandinavia, France, Germany. So what happened was that the London-based charity wanted to tackle the biggest problem for elderly. It's a chronic loneliness. In the very beginning, they created just a kind of a one-on-one connection with between the elderly and the volunteers. But technology they were using was something very, very dated, and the combination of the scheduling, matching the volunteer and the elderly was very cumbersome. What happened was that with the little help of the developers and the Twilio-powered platform, Age.UK was able to streamline their service and provide much higher impact. Imagine matching thousands of elderly and the 2,500 volunteers and scheduling the weekly 30 minutes calls and giving those elderly who are chronically lonely, giving them the chance to speak to someone about anything. I'm very proud to say that Twilio right now is part of the volunteering program there. And we also want, through our technology and also through our volunteering, for our employees being engaged, we want to help the society and we want to make an impact on the UK. So here are the couple of data points that happened after the change of the technology. We increased the call volume by 3, and in the just first few weeks, we were able to onboard the volunteers. Remember, you don't need anyone to sit in the contact center. You can pick up the phone on your with the call on your phone wherever you sit. So it's very convenient for both parties. And we got a great summary from the person from solution architect who's basically running the entire technology behind the Age.UK, that the old system was good, but with the new system based on Twilio, the Age.UK is able to help much more in a much more streamlined way. The third example I would like to show you today, very lightly, is Migam. Migam is a company. It's a small startup. It's probably 15 people at this point. That was big on helping the hearing impaired. And Polish word Migam means sign language, or I'm using sign language. And that the main problem they were tackling is that the telephone and the contact centers in general are not designed for hearing impaired. It's very hard for someone who has a problem with hearing or doesn't hear at all to get support in the bank, in insurance, or even order food in McDonald's. You wouldn't be able to communicate. So what happened was that what this startup has designed was an app which creates three-way matching between hearing impaired person, an institution, and an institution can be a bank, an insurance, a post office, McDonald's, or even furniture shop, you name it. You'll see some of the examples in a second. And also the third party, the third person on that call is a sign language interpreter. So you have this three-way conversation where basically with the click of the one button, regardless of the technology that the hearing impaired person has, this person can click the button, connect to the sign language interpreter, and then then there's a third party. So in this case, the shop or service contact center being joined, and the entire translation, entire interpretation is going live. So imagine how useful it is, and how people who would be excluded from the current world or from everyday behaviors, how this person would be able to go back with such an easy trick of just matching 3 people on a call, on a video call with on a mobile or a smartphone device anywhere they are. What is also very exciting that the person that there's a directory for the entities and the shops and any type of the institutions that have a support for Migam. They have a support for three-way meetings for sign language interpretation. So you see a screenshot. These are the real screenshots from either the mobile app or the laptop, and you can, if you need help, you can just scroll and you can just easily find the institution you want to talk to, and getting connected and getting in a queue for being helped. It's almost instant. So these are the 3 companies, there's 3 nonprofits that help their constituents or the general public in with their well-being in COVID times. Some of these use cases, as you've seen, are not necessarily only COVID or coronavirus related, but the current pandemic and the current lockdown were an accelerators for many of these institutions to make things better, because all of those contact centers got much more usage, much more inquiries during the day than they used to a year or 2 years ago. So where are we? So what's the best to do right now? If you're a nonprofit, and I believe you're a nonprofit if you're listening to me today, think about what are the communication channels that you would like to engage, which you would like to use when you're helping your constituents or working with your volunteers, or maybe your donors, because that's one of the paths as well. And where Twilio can help you is to basically mix them together. You've seen the HUK using the voice. You've seen NHS using the chatbot or text message or Facebook. Or in the case of Migam, it's a combination of video and a phone. So just think about of which of those channels are the best for your target audience. Experiment with it. In the current software world, you don't need to buy anything or install very expensive hardware at your premises or buy some devices. No, you just play it with this online with a bit of a support from developer or the technology partner. You can really make wonders within the day or two. Just go and experiment. You can call it a hackathon if you will, but just experimentation, it's a good start. Another thing is that everything we're providing, it's easy to implement and expand. Migam, for example, it took them 3 weeks to build a platform, including hiring the developer. It's not just writing, it's just first getting the person who will be able to do it. HUK went through the several iterations of the building the platform. And we recently had another use case which we're able to implement basically within a couple of days. NHS app, the Ask AVE, has been created within 3 weeks. It took us a little bit of time to make it official for NHS because there are some procedures that we have to follow. But technically, these were very, very short timelines comparing with what we've seen back in the days where there were several approvals, buying hardware, programming it, testing, where things were taking 6 months or more. The important thing with the Twilio platforms is that they, apart from the fact that nonprofits are getting a lot of stuff at the lowest pricings possible, you don't have to have almost any capital to start. You're only paying from what you use. So when you experiment or you're in the beginning of of your journey with the technology, you basically have nearly zero spend because you're just learning how to use it. Only when you scale, then you'll see with the usage that the cost will rise. All the technical documentation, we also have a partners is available on our website. We'll be able to handhold you where needed and make you build a solution just for you. That's what I wanted to cover today. As a summary, you've seen the free nonprofits, free major nonprofits, or free social impact companies in Europe that have designed their solutions to help people based on the Twilio platform. On our website, there are way more examples where big and small nonprofits or social impact companies have built a solution based on Twilio, and they're able to engage with their target audiences in a much better way. Although we have a physical distancing, socially, they're much, much closer to each other. So thank you for your time today. Feel free to go on our website and register for our nonprofit program. Feel free to contact me over an email, and I believe I'll be very happy to take some questions in a couple of seconds. Thank you.
Thank you, Michał. Really appreciate that. And Michał will be joining us in just a second. As always, if you would like to submit a question to us, you can do so by hitting the Q&A button at the bottom. Looks like 2 text boxes overlapping. You could submit them to us. We have a few coming in already, but please feel free to submit some more. Michał, thanks for joining us. How are you doing today?
Pleasure. It's fantastic. It's a great to be in a tropical London, 31 degrees outside, a little bit of a wind. I mean, why do I need to travel to Greece? With all respect to Greece.
Are you managing to stay cool then?
Natural draft and the cold water that does wonders. How are you doing, Chris? All good?
Yeah, we're good. Thankfully, we are in the office, albeit socially distanced today. We do have the
Excellent.
blessed aircon that we keep bowing down to. So
Excellent.
we're very lucky. I'll not rub that in too many people's faces. But great presentation. Thank you for doing that.
Thank you.
Really appreciate it. It covered some really key topics, and something that we're seeing quite often. As we speak to charities is, although we are no longer in the same spaces, are able to physically interact with donors or service users, our charities are finding themselves become closer, and it's sort of enacted that need to reach out and build those dialogues a lot more, and a lot clearer dialogues in that sense as well.
Correct.
I think it's a really interesting time in terms of what that bridge becomes between charity and user, or donor, and it's kind of a watch this space. What can you kind of foresee happening as we kind of go down this road, and lockdown, and while lockdown eases, I think remote working might be around to stay a little bit. What are your sort of foresights there?
What I'm seeing is that the people, one of the biggest problem of people working from home, and it's not only across in charities or non-profit social impact, is the people start losing the balance between the home and work and life, or life work, maybe in this in this order. And because of that, people are getting, there's a type of a burnout that is coming much faster. And we've seen some, this morning I've seen the report from Everest Consultancy Group, and they said actually this is the top priority for the employers, that to keep people sane, because they're spending all the time in front of their desk. And the same, especially when you live in London, where your house is probably not as big as somewhere in Somerset, that's a big problem. But that problem could be channeled through the volunteering for help, help for charities. And we've seen people, at least in Twilio, that are very open and helping just to get 20-30 hours a year, just move their brain somewhere else. So I think with the digital technologies, there's a huge potential to be closer to whoever you want to help. But yeah, the times has changed a little bit, and I think it's cliche, but yeah, times changed.
Yeah, absolutely, and I totally resonate with your point there. I mean, I'm London based as well, and I'm spending the best part of 18 hours in my bedroom at the minute, every day in and out. And it is important to give yourself those moments and health check, sound check. You feel like all you should do is work just because there's nothing else to do, right?
Exactly.
So it is
very
very
is a good channel.
Yeah, exactly. Getting out, doing something different, coming to the office, for example. We went yesterday, and today has been a bit of a godsend in that sense. Like, if you can do it safely, of course, but getting out and just a different environment and a bit of fresh air is always good.
Absolutely.
So we'll dive into some questions from the audience here. The first one, Nikki Dodd asks, if you can dive into a little bit more on the Age UK system, how exactly does that work? That would be great.
Right. So, the population of the elderly in UK it's a quite a fraction of entire population. It's just a beauty of demographics of the Western world. But those people are distant. It's and they're looking to get some degree of the connection with the volunteers. So what system does is basically it's built up. It's platform made by Age UK. It connects volunteers, people who are open to spend half an hour a week, and talk to someone who hasn't spoken to anyone in the past weeks or even months. So there's this connection, there's this phone connection between two parties. But what is important is first to preserve the secrecy and the privacy. So there are no direct calls. It goes through, let's say, the electronic switchboard, which masks the number, so we're not, we can avoid any type of the spamming or God forbid any abuse. And also there's it's a little bit on a arm's length distance, if you know what I mean. It's a connection, but it's secure for both sides. And basically what Twilio provides is just this switchboard of several thousand people from both sides, and the voice connection between them, because otherwise you wouldn't be able to control if we just use mobile phone to mobile phone. So there's a reporting, there's anti-abuse, there's a privacy, and a scheduling, which is also important, because if you're a volunteer, you're probably not, and you're still working to earn your salary and pay your bills, you're probably not open to get this conversation at 1 p.m. on Wednesday, because you probably are at work. So that's what we do at HUK. And I mean, we provide a platform, and the HUK team is just great. And them hunting for, in a positive way, for volunteers to help the elderly it's excellent. I'm on the list to become the volunteer. It's a very rigid process, because the HUK verifies the volunteers. If you're okay to speak to someone, but it's a beautiful use case for us. We're very proud of being part of it.
Sounds like it. Yeah, great stuff. So sticking with those stories, then we've had a question that's, asked what skills are needed to build all these solutions. They seem at a surface level, they seem like it can be quite in depth. Is it something that your general sort of charity professional can do themselves?
Yeah. So first of all, I was delighted to hear in the previous session the customer advice Manchester being mentioned, which is also built on Twilio, the off hours support. And basically, what you need to do to build a chatbot or to build like a text message exchange, you need to have like a basic level of software programming. But some of the stuff is a drag and drop for basic use, and that's where you start. The industry, us and others, provide very easy, like a one-on-one courses to do it. So if you have a little bit of a spare time, you can go and experiment with this. You can write by your own. Now, when the things get a little complicated, like for example the contact center for citizen advice in Manchester, that's where we're looking for a partner for a small development team. I think in the case of CAM, we had like one person coding it, and it wasn't too hard. But you need to have someone who you're going to commission. I don't think it's that expensive to just write what you need, and that's roughly what is needed. But again, it's basic things like a basic engagement by WhatsApp, by text message. It's you can if you have a basic skills, you can do it by yourself.
Sounds great, really interesting. So I'm sold. What are the first steps I can take as a charity to get started with Twilio?
The best way is to go to our website, twilio.org, and just dive in, create your account, and start exploring. There's a bit of a reading in the beginning, right? Like with every software, every tool. So
everything.
Yeah, grab yourself a big bowl of water and maybe some crisps, but it's doable. What is important for nonprofits? We have Twilio is a part of a so-called Pledge 1%, and during our when we went public several years ago, we said, okay, at 1% out of that public offering, we're going to put into the bank, so-called, and we'll distribute it to the nonprofits and the social impact companies. So as a result of that, what you do now, you create your account, and we're going to provide you the worth of $500 of the credit. So you can do a lot with the communication for $500. So just apply for non-profit status. It's called Impact Access Program. It's a one button and 3 fields to fill, so it's not a huge amount of work, and you can do whatever you want for a very long time. We have several small charities using that $500 credits for a year or more to run their everyday operations. Yeah, it's a lot, and the communication technology, unless you're a UNICEF or Red Cross, you're not going to have that mass of constituents to communicate with, so you'll be fine. It's probably going to cost you nothing in the very, very beginning for a few good months.
Yeah, so just to dig into that a little bit more, if that 500 pounds, euros, how far can that stretch for charities? What exactly can they do with that?
It goes towards every services of Twilio. So if you want to build a chatbot, or let's start even easier, you want to start text messages, something very simple to all your constituents, all your volunteers, all your donors, because that's important as well. The cost of sending the SMS in UK is around like 5p or 3p. So imagine how many text messages we have to send to burn through $500 worth of credit. Chatbots is even cheaper. WhatsApp is even cheaper than that. So everything, very happy to help you, but we're talking about the long months of the usage rather than the it's going to finish tomorrow morning.
Yeah, sounds great. So we've mentioned chatbots quite extensively. I think what would be good to explain a little bit is exactly what a chatbot is and how a charity can make the most of that.
Mm-hmm. Chatbot is the small application, the small part of your website that that gets interactive. And I think many people, we're all used to chatbots in the banks, insurance companies, TFL, and many others, where you want to talk to someone. You don't necessarily want to go through the T's and C's or through the procedure. You want to ask the simple question. So you add that, and you add that small piece on your website, and you allow your target audience, whatever target audience is, to ask you a question. Now, behind that chatbot, that's where the technology begins, the Twilio technology. You get a little bit, you get a front end from your site to see what people are asking for. You get a bit of intelligence to suggest them some of the top questions. But what happens is that, unlike other chatbots, we directly can switch to WhatsApp, to SMS, or we can initiate the voice call. So if people are more interested in digging what you have to offer, or they want to offer voluntary help or maybe donation, it's very easy for you to switch between the channels. Sorry for a little bit of the technology jargon here, but that's what we channel mean, right? The chatbot is one channel. It's a one place where you meet your target audience. It was important that you're able to switch it. If someone is on a go in a bus and you want to continue via WhatsApp or email, you like to know that this person is the same person that spoke to you in a chatbot. That's why chatbot is that powerful on a Twilio side. It's a good beginning. It's a solid beginning for a web communication.
Great, thanks for that. Really appreciate that. We have a great follow-up question from Dan Russell. Are Twilio's privacy notices and protocols set up to cover potentially sensitive personal data supplied via chatbots?
And that's thank you. That's a good one, because depending on the channel, by definition there are different standards of the safety or the certification for the sensitive personal data. Twilio is an American company, so we have to adhere to the really tough regulation called HIPAA. And being operating in a European Union, we also have to take into account the GDPR. So what happens is we have a portfolio of the channels, as mentioned: chat, SMS, email, phone call, and you name it. And we have a different certification of each of those channels. So if we're seeing that we're building the use case, for example, to gather the medical information, that's what we're doing in some Middle Eastern countries or in US when we operate contact tracing applications. When we see that by definition the channel is not designed to handle so sensitive data, we switch it somewhere else. We're automatically initiating, for example, the voice call, which is recorded, to be sure that everything which is spoken about is treated in a very careful way.
Yeah, thanks for that. That's great. So I'm a small charity. How easy is it for me to implement a chatbot into my website? Is it something that's really simple?
It requires a little bit of the clicking and probably a little bit of programming. And again, I was super delighted to hear the input from the previous session that there are teams, there are volunteers, there are companies that provide templates or scenarios to build that. So it's not that complicated. And what is most important for a small charity, you're basically using this chatbot for a very, very long time, for quarters to come, for free.
Great, thanks. And Susan actually has just chimed in with a question on what is the starting cost for chatbot. I know you mentioned this, the $500 before. What's the starting cost for the chatbot software for small charities? Is there different
There's
levels?
no there's no cost. As long as you fit within the $500, there's zero cost for you, excluding electricity that you need to run your computer on.
Great, thanks for that, Michał. So, and you've got obviously quite a diverse product offering there, lots of ways to communicate and get in touch with users, donors, and all the types of people charities reach out to as an audience. What do you see are some of the most effective channels that charities are using?
It depends on the target audience you're talking to. We usually, and it's probably the industry standard, to chop your audience into three pieces. You have your constituents, the people you care about. The second one is the volunteers, because many of the nonprofits rely on volunteer work, and also the donors. And depending on the use case, you need to figure out what's the best way to do it. If it's I don't want to talk too much about the fundraising today, because there's a separate event about that.
Gotta wait for that, yeah.
yeah. We have a wait for it, but there's you basically have to use almost, even in the nonprofit world, we're saying that the biggest nonprofits are using like a proper commercial approach to this, and it involves like a full-blown enterprise marketing approach. But let's leave it for later without going into details. In a volunteering space, it's amazing. The Red Cross America, for example, they built the dispatch based on SMS, because it's very hard to get attention of the people via email or installed application on your phone. If you see some pop-up from some random application, whether it's Red Cross, you wouldn't pick your phone up right away. What we're seeing, the 97% of text messages are being read almost instantly. So if there's and it's far the most effective and also a little bit abused communication channel, but you're going to read that SMS. You're going to ignore it later, but you're going to look what it is, and your phone will display it right away. So if there's moving to the world of nonprofits, if there's an emergency, and we deployed it in the tornado valley in US, and the volunteers have to get there, or they have to confirm they're ready to help. You want this to be high priority for everyone, right? So it's text messages. Then things like, but that's a mass communication, and we're talking about hundreds of thousands of SMS being sent just to mobilize the team. Another thing what we're seeing is the conversations with any of your target audience via text message, because they probably don't want to install yet another app, go to yet another website, but it's sending a text message. Hey, we're here, and this is what we're doing. How about clicking this, going on the Twitter, and tell us what you think, 1, 2, 3. And there's a little bit of a conversation going. It's a little bit of gamification, right? So these are the very basic things what you can do with a text message. If there's more coming, like video, like text, more links, you might want to consider going to WhatsApp. There are several organizations, both in a crisis response, but also with the general engagement, using WhatsApp in a, let's say, organized way, that you're not doing it from your phone. You have a special application, you have a special software installed on your computer, and you basically are able to get intelligence out of what people are telling you in those one-to-one communications. So there are many ways, and then imagine you can add video, like in a MEGAM, or in any education or telemedicine. It's you can surround your target audience in many ways, and just keep them happy, keep them engaged, and be on top of mind. Because one of the things that you're seeing these days is people are flooded with Instagram, with Facebook, with everything, Snapchats, and if you're not as active as them, as the other social networking destruction, you're going to be priority number 2 and 3. We've seen it. You have to be active.
Yeah, and I want to deep dive into that with you in just a minute. You've kind of preempted a few questions that I've got on my list for you there. First one was the text messaging, because that was really interesting for me. I think text messaging kind of has this, or maybe this is just me kind of important. This has a bit of a stigma around it of being not the most safest, not the most efficient, but those numbers kind of speak for themselves in terms of 97%. But on the same hand, I don't know if you're aware of blood.co.uk, the blood donation service. They do this incredibly in a way of sort of completing that sort of user loop or user journey, as you call it, where you go different type of donation as you give a charity. Granted, you go donate at a blood donor centre, a community centre, wherever it is. They've got your details. You get your cup of tea and your club biscuit or your penguin, depending where you are. You move on, and then within a few days, you get a text message, which I remember the first time it happened to me, I was like, wow, that's great. And all they're saying is, this is where your blood's gone and this is who it's helping.
Yeah.
And I think that's, in terms of an example for charities who are looking to use a service like that, it is phenomenal, because that made me feel part of it.
Yeah.
It really brought me in, and was like, oh, that's incredible. It's good to know that that's gone on to help someone. So I think it's, there is ways and means to be able to do that sort of thing. I think it's really great.
I'm with you. I mentioned it during the presentation. We're working with one of the biggest and the most known charities in the world. I cannot mention the name because it's not official, and I'm not trying to brag, but I'm just trying to show you the size of a problem. They're sending every year. They're sending one email to their donor. Thank you. Would you mind continuing?
Yeah.
Right around Christmas time. No, it's not going to work. People, their conversion rates and everything, their engagement is, it's not working. So small, more nimble charities, like you mentioned, the blood donor, it's way better. It's not about sending you anything. It's keeping you involved, because by definition, if you're volunteering, you're sold on the purpose, not on money, right? So it's important to keep involved and inform what they do. Yeah, absolutely.
Yeah, and have you seen a big emergence in WhatsApp? I think Hannah Underwood's just posted a question about what channels younger audiences are preferring to use for communication. My mind would immediately go to WhatsApp, but I would have thought more generally that'll be having a bit more of an impact given the current environment.
In UK, I cover entire EMEA, so whenever I work with the charities, either like Age UK or NHS Scotland, but also we're working with the really poor people in the refugee camps in Kenya or Uganda, and it really depends on the profile. I'd be surprised that we're doing the project right now in Brazil. And we had the same question: what are the communication channels?
Yeah.
And yeah, let's go for WhatsApp. Like, hold on a minute. Are the people, with all respect, are people from the from the older generation? I can't be polite enough here. Are going to use WhatsApp, right? Because it's a newbie. Apparently, everybody in Brazil, regardless of the age group, uses WhatsApp. It's an everyday tool. In UK, what we're seeing, it's if you're, let's say, over 65, you're much more your preference turns more into like a human interaction channels where the voice is very strong.
Mm-hmm.
And in one of the English-speaking countries in this region, we helped the Ministry of Health with the contact tracing, and that was one question: how do we tell people what they should do? The millennial will get a text message which says, "Stay home for 14 days and watch Netflix." Good enough, no problem. But if you have someone who's got already grandchildren, that text message won't work. So we're switching the channel, right, from the simple text message, and we're calling, not we, the services are calling the person, "Hey, here's what it is. You might want to consider strongly staying at home. Do you have any questions?" So younger you go, less interactive you have. So text message is fine, although it's bizarre for young people. Like, what do you mean 153 characters and no pictures? What the heck is that? But it's very effective.
Yeah.
And a WhatsApp, because WhatsApp and also the Facebook Messenger, because unfortunately the youngest generation is glued to the Facebook. But so the moment something pops up in the Facebook, you have a high chance of this being read by them.
Great, thanks for that. And one thing we're seeing from and conversations we're pushing forward within the sector as well is that user-generated content's becoming such a big thing. So donors especially are now the ones being on being creative on the charity's behalf instead of relying on the campaigns of other charities. What sort of two-way process does Twilio have to be able to elevate that and allow donors to come back to charities as well as charities go to donors?
Right. So there are many interesting activities going on out there on using Instagram challenges, TikTok challenges. But always the question is, okay, I've got so much involvement. People are spilling water on themselves, jumping from somewhere. They're nominating people. But what's the in the end, in the fundraising again, what's the point, and how are we going to increase the conversion? Because engagement is great, but now you have to turn that red hot engagement into a long-term value of your donor, and that's where the combination of the platforms like Instagram, Snapchat, or TikTok come. That once this is running, you're gathering the list of the people who are doing this, right? And you can do it automatically by small tools that those platforms provide. And the moment you have this, you start the user journey, right? Conversion journey from just an engagement to money. And it's possible. We're doing this in Asia from one of the very big charities that they started it. They had a great engagement, great numbers, but it's not a single dollar in a bank.
Interesting, thanks for that. And last question before I let you go and enjoy the sunshine. As you rightly said, we are seeing more noise than ever before. It's everyone. When COVID started, there was 100 emails sent out from a letter from the CEO to say this is what we're doing. It has become more difficult to be heard in the digital sphere. So what advice would you give to charities to sort of stay ahead of that comms curve in terms of reaching out and being heard, essentially?
Get a representation of the people you're talking to, and make a hackathon. Hackathon is a very big word, but it's probably get them in the room, give them a couple of beers if they're in the over the legal age, and tell them what they would like to hear, how would they like to be engaged, what's important for them, and based on that, create the digital journey. Forget about technology. Please, it's recorded, so I shouldn't be saying this. Forget about Twilio. It doesn't matter. Take a blank piece of paper, create the line, and how should we talk to you and the people in your group? What's the best way? And we did it with one organizations a month ago. We had 4 teams across the world. We had people from UK, Iceland, Brazil, Tanzania, China, Japan, Panama, and Colombia, I believe. And we just gave them the same thing, like how, in your region, what would be the best way to keep you updated what you're doing, and how can you get involved? It had nothing to do about money. It was more about volunteering and being, and they it was mind blowing. 3 days later, we got the presentations, which are like, yeah, we have to do it now. So just give the voice to the people you're trying to talk to and hear from them. Don't, you probably it's going to be a lot of out of comfort zone conversation for you, like really, but it's the best way. It's really, really working well.
100% agree.
And we're happy to help. Really, it's if you're a large organization or you're a couple of organizations, we can build a hackathon for you. And without technology, without selling anything, you will see that the people have a great ideas out there.
Great, thanks very much. No, 100% agree. It's all about talking to other people at the end of the day. Look, it's been a pleasure to talk to me. I really appreciate you joining us.
Thank you very much for inviting me.
Absolutely, our pleasure. Enjoy the rest of your day, and we'll catch up later.
Will do. Thank you, everyone. Have a wonderful day.